Do you experience constant dryness in the eye? Or have you noticed a change in the size of your eyes recently? Did you know that these could be a cause due to a dysfunctional thyroid? Hi, I'm Dr. Swathi. I practice orbit and oculoplasty at Shekar Eye Hospital, and I shall walk you through the disease spectrum of what is called as Thyroid Orbitopathy or Thyroid Eye Disease. Thyroid glands are a butterfly-shaped gland which is placed at the base of our neck, and they secrete certain hormones which regulate the body metabolism and body other functions. So they monitor or keep a check on our breathing, heart rate, muscle strength, body temperature, our menstrual cycle, the amount of tears secreted in the eye, and the central nervous system as well, and much more. So what happens when these hormones are secreted in excess or less in quantity? So the T3 and T4 hormones, when they are secreted in excess, it's called hyperthyroidism. In hyperthyroidism, one may experience anxiety, excessive sweating, palpitation, sleeplessness, and weight loss, hair loss, etc. And when the hormones are less in the body, it's called hypothyroidism, where one experiences lethargy, sleep disturbances, weight gain, cold intolerance, dry skin, etc. How frequent is it that these patients experience eye symptoms? So when a patient presents with eye symptoms, it is known that he is 90% of the times in a hyperthyroid state. But 10% of the times he could be in euthyroid, where the thyroid hormones are normal in level, or hypothyroid state, where the hormones are less in quantity. So, which means that even if you have been diagnosed of a dysfunctional thyroid, but your hormones are in control, does not rule out the fact that you are susceptible to get eye symptoms. So what is thyroid eye disease? Earlier it was called Graves' orbitopathy. It's an autoimmune condition where the body's defense army starts targeting its own tissues. Apart from the thyroid gland, our eye muscles and fat tissue around the eyeballs also have receptors for thyroid hormones. So the antibodies which are produced go bind to these receptors and incite an intense inflammatory reaction. So because of the inflammation, there is swelling of the tissues of the eye along with swelling of the thyroid gland itself. These generally have a course of active and inactive phase. So initial 2-3 years there will be an inflammatory phase. Subsequently, every tissue heals with scarring. What are the risk factors for this thyroid eye disease? It is noticed that females have a 5 to 6 times more chance of developing them when compared to males. Smoking is one of the modifiable risk factors. Stress or radioactive iodine given for the treatment of hyperthyroidism. And age-wise, it can vary from 8 to 80 years of age. But yes, as the age advances, the severity also increases. What does a patient complain in a thyroid eye disease? What can you have? Initially, you may develop grittiness in the eye, dryness in the eye, redness on and off, and burning sensation in the eye. As the disease progresses, the tissues start swelling up. That results in bulging or prominent eyeballs and a constant staring kind of a look. Along with that, when the muscles start to swell up, the eyeball is not able to move in all the gazes, resulting in double vision. When very severe, the swollen tissues start to compress the eye nerve, resulting in a decreased vision. Also, when the eyeballs are too prominent, our eyes don't shut well. So that results in something called exposure, resulting in a diminution of vision. These are the eye symptoms, and this will be along with the other bodily symptoms which occur because of the hyper or hypothyroid state. So whenever you visit the eye hospital, the first thing that we do is assess your eye nerve function through the basic tests and also a few tests like visual fields and color vision that gives us an idea of the health of the optic nerve. That apart, we also would want to know what is the thyroid status in your eye. So the doctor might advise you for basic thyroid hormone levels, also antibody levels to keep a check on the autoimmune part of the disease, and finally an imaging. The imaging is advised in the form of CT or MRI. That gives us an idea of how much have the tissues swollen up. Are they really causing pressure on your eye nerves? We get to know all of this. So once your diagnosis is confirmed, the primary treatment involves, like in any other systemic conditions, the systemic condition has to be brought under control. So your hyper or hypothyroid should be brought under control. So that we team up with an endocrinologist who keeps a check on your thyroid hormone levels. Sometimes it's controlled through tablets or other medicines. Sometimes you may be advised a radioactive iodine, and rarely, when it's not managed with these two, your doctor may advise you to undergo a surgery where the thyroid gland is removed, either partially or completely. So once the systemic status is brought under control, simultaneously eye is managed. In milder forms of eye diseases, what we do is just observe, keep a check on your vision, and give you a lot of tear substitutes. Keep a slight head end elevation so that you don't get the pain around the eyes, and a few supplements of vitamins and minerals. As the disease progresses, or if it's moderate or severe level, it cannot be managed with this alone. You will require a course of immunosuppression. That is generally done with steroids, either oral or intravenous, depending upon the severity, along with non-steroidal immunosuppressants. Generally, the treatment course goes around till 6 months to sometimes even a year. So, very rarely, when the vision is being damaged, when the nerve is being damaged, your doctor might advise you to undergo a decompression surgery so that the swollen eye tissues can still sit inside your bony socket. Later on, in the inactive phase, that is probably after 2 to 3 years, what we can do is a reconstructive or cosmetic correction. Post-thyroid inflammation, many of us can continue to have prominent bulgy eyes. Many of us can continue to have starey eyes where the lids are retracted up. Some of us can have residual squint because the muzzle becomes scarred and it is still unable to move. So all these corrections are done when the disease has entered a quiet or a recent phase.